Hi, how are you today?
Good, how are you?
Good. My name's Sam. I'm going to be your nurse this afternoon. Can I have you identify yourself by your name and date of birth, please?
Yes, Chris Weiss, 11/8/89.
Okay, perfect. So I'm just going to wash my hands, put on my gloves, close the curtain. Are you comfortable where you are?
I am.
Do you feel safe right now?
I do.
Okay. So today we're going to be doing a full head-to-toe examination on you. It's going to include just inspecting, palpating different areas, and listening to your heart and lungs. Is that okay with you?
Yes.
Okay, perfect. So to begin, the patient is alert. Do you know what day of the week it is?
Yes, it's Friday.
Okay, and who is our president?
Donald Trump.
And where are you?
I'm at home.
Okay. So the patient is oriented to person, place, and time. His speech is distinct and clear. He appears well groomed. His fingernails are clean. His clothes are clean. He is dressed appropriately for the weather. His facial expressions are appropriate for the setting. And his posture, it appears seated comfortably. So now moving on to the HEENT portion. First, I'm just going to go ahead and inspect your head. Oops. Okay, so let's see. Looking at the head, the hair is distributed evenly. There are no lesions or masses or parasites seen. Is there any tenderness when I palpate your head?
No.
Okay, so no tenderness with palpation. The head is normocephalic. Looking overall at the skin on the face, it is pink. There is no redness or lesions on the face. There's no cyanosis or pallor noted. And then, let's see, looking at the eyes, his eyebrows are symmetrical. The hair is distributed evenly. The eyelashes are distributed evenly on both the upper and lower lid margins, and the eyelashes do curve outward. Looking at the sclera is white. There are no lesions, no foreign bodies, no discharge, and no redness. Can I have you pull down on your lower lid and take a look? Okay, good, thank you. The conjunctival sac is also pink. There's no redness, no discharge, no lesions or foreign bodies seen. Now I'm going to have you just look straight ahead. I'm going to shine the light in your eyes. Okay. The pupils are a 2+ bilaterally. They are equal and round. They are reactive to light. Now I'm going to have you take a look at that spot on the back wall there. And then look at the pen close in front of you. Okay. And the pupils do accommodate to near and distant objects, so they are perla. Next, what I'm going to have you do is follow my pen using only your eyes without moving your head, okay?
Okay.
Okay, perfect. So the patient is able to follow all 6 cardinal directions of gaze. There is no extraocular muscle weakness noted, no nystagmus noted. This also means that cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens nerves are intact. Last, for the eyes, we're going to use the Snellen chart. So you're going to stand here 20 feet away. Can you cover your right eye for me? And can you read line 5?
Yes, XJ245.
Okay, and can you read line 6?
Oh, sorry. Say
That's
line.
okay.
Yeah. Line 6. No, I can't read that one.
Okay, so in your left eye, you have 20 out of 30 vision. Can you cover your left eye now? We're going to test your right eye.
Yep.
And can you read line 5?
XJ245.
Okay, can you read line 6?
No, I can't read that one.
Okay, so again, you have 20 out of 30 vision in that eye, in your right eye. So that means you can see at 20 feet what others can see at 30 feet. And in testing that with the Snellen chart, we see that optic nerve number 2, or cranial nerve number 2, the optic nerve is intact. Moving on to the ears, let's see, the ears are symmetrical in size and shape. The skin color is consistent throughout. It's consistent with his ethnicity. There are no lesions or masses seen. His ears are aligned with his eyes. I'm going to take a look inside your ears really quick. Okay, looking in the external auditory natus, there is no redness, there's no discharge, no excess cerumen or lesions seen. I'm going to take a look on this side. Okay, so again, there is no redness, no lesions, no discharge or excess serum seen. Now, do you have any pain when I pull on your pinna?
No.
What about when I push on your tragus?
No.
Okay, and on this side when I pull on your pinna?
No.
And push on your tragus?
No.
Okay, so no tenderness or pain when the pinna is pulled or the tragus is pushed. Now with the ears, I'm going to have you cover your right ear. I'm going to stand behind you and whisper a word. I want you to repeat it back.
Peanut butter.
Okay, now I'm going to do the same. If you could cover your left ear, I'm going to whisper a word on this side.
Candy cane.
Okay, perfect. So hearing is equal bilaterally. So this also tests cranial nerve number 8, the vestibulocochlear nerve. It is intact. Okay, now moving on to the nose. The nose is midline. The skin on the nose is consistent with the rest of the face. It's consistent with his ethnicity. There are no lesions, no redness, no discharge seen. There's no dryness. I'm going to take a look inside your nose. If you could tilt your head back for me. Okay. The nasal mucosa is red. It is moist. There's no bleeding, no swelling, no discharge, and no septal deviation noted. Now what I want you to do, if you could cover your right nostril and take a breath in. Perfect. And can you cover your left nostril and take a breath in? Okay, perfect. So bilateral nares are patent. Now what we're going to do, I'm going to close your eyes and cover one of your nostrils and tell me what you smell in front of your nose.
Vanilla.
Okay, and can you do the same with your other nostril?
Yep. Peppermint.
Okay, perfect. So cranial nerve number 1, the olfactory nerve, is intact. Now moving on to the mouth. The lips are pink. They are moist. There's no dryness, cracking, or lesions seen. I'm going to have you just open up. I'm going to take a look inside. Okay, so looking inside, it looks like all 32 teeth are present. There's no evidence of dental caries and no evidence of ongoing dental work noted. The oral mucosa was pink. It was moist. There was no redness, bleeding, discharge, swelling, or lesions seen. Now, if you could pull down on your lower lip, I'm just going to take a look at your gums. Okay, thank you. The gums are also pink and moist. There's no swelling or bleeding or lesions seen. Let's see. Next with the mouth, I'm going to have you just stick out your tongue for me. I'm going to take a look at your tongue. Okay, can you lift it up? Thank you. Okay, so the dorsal surface of the tongue is rough and bumpy. It was pink and moist, and the tongue protrudes midline. So cranial nerve 12, the hypoglossal nerve, is intact. And then the ventral surface of the tongue was smooth and shiny, and the veins were prominent. Last thing we're going to do with the mouth, this is the last time I'm going to ask you to open. You can just open wide and say ah. Perfect. Okay, so the uvula rises midline with phonation. Cranial nerve number 10, the vagus nerve, is intact. And the tonsils were a 2+ bilaterally. They were pink and moist, and there was no redness or exudate seen in the tonsils. Okay, so next what I'm going to have you do is just swallow. Okay, perfect. So cranial nerve 9, the glossopharyngeal nerve, is intact because there was no dysphagia. Next, we're going to be moving on to the neck. So just generally inspecting the neck, the skin on the neck is consistent throughout. It's even, there's no lesions, there's no redness, no lesions. I'm going to palpate your neck. Let me know if you have any tenderness with this. Any tenderness? Okay, there is no tenderness in the neck, no edema in the neck. The neck does not have any involuntary movements. And there are no masses in the neck. So let's see, looking at your trachea, the trachea is midline. I'm going to displace your trachea and palpate your thyroid gland. Let me know if there's any tenderness with this.
No.
Okay, so no thyroid tenderness, no thyroid enlargement or nodules noted. And I do want to say overall, with the skin appearance, there's no cyanosis or pallor noted either. if I didn't already say that. Okay. Okay, so now I'm just going to palpate your lymph nodes. Let me know if you feel any tenderness with any of these, okay?
Okay.
So we have the pre-auricular, the post-auricular, the occipital, and then we have the tonsillar, then we have the submandibular, the submental, the anterior cervical, the posterior cervical, and the supraclavicular. Any tenderness with any of those?
No.
Okay, so no tenderness noted in the lymph nodes mentioned. Now what I want you to do with your, if you could just push your head up against my hand here. Okay, and on this side. Okay, and then shrug your shoulders up against my hand. Ooh, okay. So the strength in the neck and the shoulders is a 5 out of 5. This also indicates that cranial nerve number 11, the spinal accessory nerves, are intact. Now we're going to test the range of motion in your neck. So if you could tilt your head all the way back and touch your chin to your chest now. And bring your head back up and turn to the right and the left. And can you make a circle with your head? Okay, perfect. So range out of motion in the neck is 5 out of 5 for hyperextension, flexion, rotation, and circumduction. Now we are going to test some other cranial nerves. With this, I want you to close your eyes and tell me where you feel me touching on your face.
Left forehead, left cheek, left jaw, right jaw, right cheek, right forehead.
Okay, perfect. So the sensory aspect of cranial nerve number 5, the trigeminal nerve, is intact. Now I'm going to have you keep your mouth shut. I'm going to try to pull your jaw open. Okay, perfect. So cranial, the motor aspect of cranial nerve number 5, the trigeminal nerve, is intact. Jaw strength is a 5 out of 5. Next, what we're going to do, I'm going to have you smile and frown and raise your eyebrows. And now I'm going to try to pull your eyes open, keep them shut. Okay, so cranial nerve number 7, the facial nerve, is intact. And I just want to make sure I went over all the cranial nerves. So we did 1, olfactory, we did 2, the optic with the Snellen, we did 3, 4, and 6 with the 6 cardinal directions. We just did 5, sensory and motor. And then 7, we just did facial. 8 was vestibulocochlear. 9, glossopharyngeal was swallowing. 10 was vagus, uvular rises. 11 was spinal accessory. And 12, tongue protrudes midline, hypoglossal. Okay, so we covered all 12 cranial nerves. We are officially done with the HEENT portion. Now we're going to be moving on to the thoracic, the heart and the lungs part of the exam. So let's see, taking a look at the thoracic cavity, the anterior posterior diameter is less than the transverse diameter. Looking at his respirations, normally we would do this for 1 minute. For the purpose of this exam, I'm going to do it for 15 seconds times 4. So just breathe as you normally would. Okay, his respirations are 16 per minute. They are even and unlabored. There is no use of accessory muscles, and there is no cough present. And there's symmetrical chest rise and fall. For this next part, I'm going to have you go ahead and stand up. So first off, just looking at the chest, the skin is consistent throughout. It's consistent with his ethnicity. There's no redness. There's no cyanosis or pallor. There are no lesions or masses seen. So now what I'm going to do, I'm going to just right here and have you take a deep breath in. Okay. So anteriorly there is symmetrical chest expansion. Now what we're going to be doing, every time I move my hand, I want you to say 99.
Okay. 99, 99, 99, 99, 99, 99, 99, 99.
Okay, so anteriorly, tactile firmness is even throughout bilaterally. Now I'm going to be listening to your breath sound. So every time I move my stethoscope, I just want you to take a deep breath. And for this, normally the stethoscope would be on the skin, and I will be listening for full inhalation and exhalation. Okay, and now for this next part, I'm just going to have you lift your arms up. I'm going to listen on your sides. Okay. And again, for this part, the stethoscope would be on the skin. Okay, perfect. Okay, so anteriorly and laterally, bilateral breath sounds are clear and equal throughout. There are no adventitious sounds noted. Now I'm just going to palpate your chest. I just want you to breathe normally. Okay, there are no heaves or thrills noted anteriorly. Okay, so now I'm going to have you turn around. We're going to do the same thing on your back. And I didn't think about this for the front, but we're going to turn a little bit more for the camera. Okay, so again, I'm just going to, right here, if you could take a deep breath in. Okay, posteriorly, there is symmetrical chest expansion. Actually, can I step forward a little bit? Just make sure I can see this. Okay, and now again, every time I move my hand, if you could just say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, perfect. So posteriorly, tactile fremitus is even throughout. Again, we are going to be listening to the breath sounds. So if every time you might move my stethoscope, just take a breath in and out. And again, the stethoscope would be placed on the skin here. Perfect. So posteriorly, bilateral breath sounds are clear and equal throughout. There are no adventitious sounds noted. Next, what we're going to be doing on the back, we're going to be looking at the spinal alignment. So just looking generally at the spine, there is no asymmetry, there are no masses or deformities, there's no evidence of lordosis, kyphosis, or scoliosis. We are also going to be checking costovertebral angle tenderness. So with that, we're going to be percussing. When you feel my hand tap, just let me know if there's any tenderness, okay?
Okay. No. No.
Okay, so no tenderness noted in the costovertebral angle tenderness area. I believe I went over this, but the skin on the back is clear and like it's equal. It's consistent throughout. It's consistent with its ethnicity. There's no cyanosis or pallor noted on the back. There are no lesions or redness seen on the back. Yes, so okay, so go ahead and turn back around. That completes our posterior assessment. So now we're going to be moving on to the heart portion of this. So first I'm just going to feel your carotid pulses. Okay. Okay, so the carotid arteries are a 2+ bilaterally. Now I'm going to be listening to them. So for this part, when I put my stethoscope on, I want you to take a breath in, exhale, and then hold.
Okay.
Okay? And then catch your breath. We're going to do the same thing on this side. Ready? Okay. So in bilateral carotid arteries, there are no bruits noted. And I would like to mention for that portion of the exam, typically you would use the bell of your stethoscope. With my stethoscope, I don't have a bell. Mine, you just push it in a little bit further and you get the same feature. Oh, I need this again. Now we're going to be listening to the heart sounds. So this may take a few minutes. I'm just trying to get a good listen, okay?
That's good.
And again, the stethoscope would be on the skin for this portion of the exam. So this is the second intercostal space on the right sternal border, the aortic valve. Okay, and then we have the second intercostal space on the left sternal border. This is the pulmonic valve. And then we have the third intercostal space on the left sternal border. This is Erb's point. Then we have the fourth intercostal space on the left sternal border. This is the tricuspid valve. Okay, and then this is the fifth intercostal space at the left midclavicular line. This is the mitral valve. And the mitral valve is the point of maximal impulse. It is the apical pulse. So listening to the heart sounds, there were no extra heart sounds noted, no murmurs noted. S1 and S2 were present with a regular rate and rhythm. Okay, so now that we're done with the cardiac portion, I'm going to have you lay down. We're going to move on to the gastrointestinal portion. And you can just, yep. I'm just going to move these over. Okay, so starting with the gastrointestinal, first you just get down on the patient's level. So looking at the contour of his abdomen, it is rounded. The skin color is consistent with the rest of the body. There are no lesions noted, no scars, no masses seen. So now the next thing we do with the GI, we auscultate before we palpate. So I'm going to listen starting in the right lower quadrant, working my way from right lower to right upper to left lower. And I'll be listening for a full minute in each quadrant. And the stethoscope would be on the skin for this as well. moving to the right upper quadrant. And moving to the left upper quadrant. And moving to the left lower quadrant. Okay, so vowel sounds are present in all 4 quadrants, and they are normoactive. So next we're going to be doing a light palpation. So again, I'm just going to be starting in the right lower, working my way around back to the left lower quadrant. Let me know if you feel any tenderness when I do this. Any tenderness?
No.
Okay. So there is no tenderness noted. There is no abdominal rigidity. There is no guarding, and there are no palpable masses or deformities. Next, we're going to be going in with a deeper palpation. So you'll feel more pressure. Just let me know if there's any tenderness with any of this. Okay? Any tenderness?
No.
Okay, so again, there is no tenderness. There's no rigidity or guarding. There are no palpable masses or deformities with deep palpation. Okay, so we are done with that portion. You can go ahead and sit back up and put your shoes back on. Actually, you can keep your shoes on because I'll be feeling your feet in the next portion. Okay, and so let's see. Have you had any difficulties or any abnormalities recently in your urinary or bowel habits?
No.
Okay, and when was your last bowel movement?
This morning.
Okay, perfect. Okay, so now we're going to be moving on to the musculoskeletal portion of the exam. So actually I'm going to have you scoot forward. I'm just going to kind of get down on your level for this part, because I'm going to be looking at your arms first. So looking at the arms, let me know if there's any tenderness while I palpate them. Any tenderness with any of this?
No.
Okay. So no tenderness noted in the arms. The skin color on the arms is consistent throughout. It is consistent with his ethnicity. There are no lesions. There are no masses. There are no scars or deformities. There is no edema or redness noted. Yeah, once. They're good at this. And the skin is warm to the touch. So next what I'm going to do, I'm going to feel your pulses. So I'm going to have you kind of lift your arms out like that. First we're going to do the brachial pulses. Okay, so the brachial pulses are at 2+ bilaterally. I'm going to do your radial pulses. I'm just going to move your watch back. Okay, and the radial pulses are also a 2+ bilaterally. Now I'm going to be checking your capillary refill. Okay, capillary refill in bilateral fingers is less than 3 seconds. So now I'm just going to be moving on to inspecting your legs. For this portion, let me again know if there's any tenderness or pain, especially in your calves.
No.
And then your feet.
No.
Okay, so there is no tenderness noted in bilateral legs. The skin color is consistent throughout. On both of the legs, there's even hair growth. There's no edema. There's no redness, no lesions or scars. The skin is warm to the touch on both legs. We're going to check the the pulses in these legs now. Can I have you bring your legs out a little bit? checking the popliteal pulses behind the knees. Okay, and the popliteal pulses are a 2+ bilaterally. Now I'm going to have you bring your legs back in. We're going to check the posterior tibial pulses. So this is behind the medial malleolus. So I know it's difficult to see. And the posterior tibial pulses are a 2+ bilaterally. Now we're going to be checking the dorsalis pedis pulses. And the dorsalis pedis pulses are also a 2+ bilaterally. Now checking the capillary refill in your toes. Capillary refill in bilateral toes is less than 3 seconds. Okay, so now what we're going to be doing, we are going to, since I was just touching your feet, I'm going to take off my gloves, wash my hands, and put on new gloves. Now we are going to be checking the strength and the range of motion all throughout your body.
Okay.
So I know we did this once already, but we're going to do it again. If you could just push your hand up against my hands, okay, and again. Okay, and shrug your shoulders up. Okay, perfect. So strengthen the neck and the shoulders is a 5 out of 5. Can you bring your neck all the way down and tilt your head all the way back? Okay, and now go right to left. Okay, so range of motion in the neck is 5 out of 5 for hyperextension, flexion, and rotation. For this next part, I'm actually going to have you stand up. We're going to test your arms for this. So first, I'm going to have you just bring your arms up, and then bring them back down, bring them out, and then now we're going to go like in a circle. Perfect. Okay, so range of motion in the arms for abduction, adduction, hyperextension, and circumduction is a 5 out of 5. Now we're going to test your strength in your arms. So put your arms up like this, and don't let me pull them down. Okay, perfect. So strength in the forearms is a 5 out of 5. Now I want you to grip my hands. Okay, so grip strength is also a 5 out of 5. Now with your legs, you're going to go ahead and have a seat again. With your legs, I want you to extend both of your legs straight out. Okay, and bring them back down. Okay, and now I'm going to have you push up against my hands and push down, and then push your legs out against my hands. Okay, so range of motion in the legs for extension and flexion is 5 out of 5. Dorsiflexion and plantar flexion is also a 5 out of 5. And then abduction in the legs is also a 5 out of 5. So the neck, arms, legs, and feet. Now what I want you to do, I'm going to have you stand up again. If you want to put on your shoes for this part, I'm just going to have you walk. So I'm going to have you walk from here to here and back. Okay, good. So the gait is even, it is effortless, his arms swing appropriately. Now we're going to, I'm just going to have you stand here for 20 seconds. Your eyes are going to be closed with your arms down at your side. Okay, so there is no swaying noted, so the Romberg test is negative. Okay, now the last thing we're going to do is test your reflexes. So for this one, I'm going to have you stand up. Rubber spatula. For this, we're going to check your biceps reflex. Yep, and just relax it completely. This is awkward. Sorry, can you help me real quick? Just get it in position. Okay, and then you can relax it. I'm sorry. Okay, and we're going to check this side. Okay, so the biceps reflex is a 2+ bilaterally. Now I'm going to have you sit down. This next one, I just want you to dead weight your arm. I'm going to hold it up myself. Okay, that's good. Okay, and again. Just relax it completely. Okay, the triceps reflex is also a 2+ bilaterally. Now I'm going to do your brachioradialis. Go ahead and relax your arm completely. Okay. And relax it. Okay, the brachioradialis reflex is a 2+ bilaterally. I'm going to have you go ahead and kick your shoes off and kind of sit back further on the couch so that I can have your legs dangle as much as possible. Okay.
How was it going?
Hey. Okay. So the patellar reflex is a 2+ bilaterally. This works great. Now we're going to do the Achilles reflex. Okay. And again. Okay, so the Achilles reflex is a 2+ bilaterally. And then the last one we're going to do, I'm going to kind of hold your leg up myself. And we would run this from the lateral into the medial foot, under the toes. And again on this side, from lateral to medial. Okay, and that is the plantar reflex. It is a super reflex, or superficial reflex. It was there because his toes curled in and there was a little bit of plantar flexion noted. Okay, so that completes our examination for today. Do you have any questions for me?
No.
Okay, perfect. Here are your items. Here's the call button. If you need anything, just press that.
Thank you.
You're welcome. I'm going to take off my gloves and wash my hands. Are you still feeling comfortable where you are?
I am.
And you feel safe?
I do.
Okay, I'm going to make sure the bed is in the lowest position. Have a good day.
Thank you.
Mm-hmm.